Hi Gemma, thank you very much for joining us today to talk about your fantastic work here at UCL Engineering as part of the INWED 2020 celebrations. Perhaps you could start by giving us an overview of your field and your work.
So I'm a medical physicist and I develop tools to monitor the brain. I'm focusing on developing tools to monitor the brain during intensive care. So if a patient has a brain injury, it's really hard for doctors to monitor the brain while the patient's in intensive care in bed. So I develop optical tools, so using light to illuminate the brain and find out what's going on inside. So these tools can be sort of small and compact bedside tools where we shine light into the brain, detect some of the light that comes back out, and that will tell us something about what's going on inside the brain and how well the brain's functioning.
And who or what inspired you to want to become an engineer?
It took me a really long time to realise that I am an engineer. I always loved doing maths and physics at school, and I sort of thought, okay, maybe I could be a physicist or a mathematician, but whenever I looked into what engineering was, it seemed like it was all sort of men on construction sites wearing hard hats, and I was just like, well, that's not for me, that's not what I want to do. It wasn't until I studied physics and then I got involved in medical physics, and at UCL medical physics sits within engineering. I sort of started to realize, oh, maybe what I am doing is engineering. I'm using maths and physics tools to solve problems, and it took me a really long time to realize that I am an engineer, and engineering is really diverse and really a huge range of different, essentially problem solving challenges, and that's why I'm so passionate about communicating it.
Great, thank you. What's your favorite part of your job?
I think my favorite part of my job is working in teams with people, and especially people from outside of my area. So as a medical physicist, I build tools that can measure the brain. And so I get to work with people who either study the brain or are doctors and working to treat the brain. Anybody who's interested in the brain, really. And I get to learn about their work and see how my work fits in. So I really enjoy the sort of collaboration part of science, talking to people about developing new technology, working on new ideas, solving completely new science or medical problems. That's the most exciting thing for me.
What's the most valuable lesson you've learned so far?
So I think the most valuable lesson I've learned is to prioritize what I enjoy and what I think is the most important about my work. As an engineer or a researcher, you have lots of different sort of roles to do. So you have to do obviously the science and the research, but you also have to communicate science. And I found that a really big, most important part of my work is doing science communication through public engagement, outreach work. And I had a lot of people telling me that I was doing too much of that and I should be focusing on doing the real, focusing more on doing more research, more writing papers and things. But I really persevered and continued doing what I thought was most important. And that has actually opened a lot of doors for me. It's given me a lot more opportunities. I've learned a lot of skills. And I've really found that I'm enjoying my career much more because I'm doing what I want to be doing and what I think is important.
Yeah, that's good to hear. Can you describe your day-to-day life? So perhaps pre-lockdown.
Yeah. So pre-lockdown, my day-to-day life every day was completely different. Some days I'd be in an optical lab, which is literally a pitch black room where we'd be sort of working on optical devices and trying to sort of improve our brain monitoring devices. Other days I'd be in a hospital intensive care unit trying to make sure that the device is working well in the hospital. It's really, really varied. Lots of meetings, as I said, collaborating with different researchers. And then there's lots of time sort of analysing data, writing code to process the data that we're collecting from the hospitals.
That's great. Must keep it really interesting.
Yeah, definitely. Yeah, no day is the same.
So how has the current COVID-19 situation affected your day-to-day work?
So being in lockdown means that we're not able to build new devices in the lab. We're not able to collect data from patients or from human studies. But luckily it doesn't, we do have a lot of data that we've collected in the past that is sort of, to be honest, waiting to be analysed. So it's been a good chance for me to sort of knuckle down to a lot of data analysis and start writing up a lot of the work I've done before. In terms of working with other researchers. It's been quite a good opportunity to sort of get used to virtual meetings, and a lot of our collaborators are from different universities or even in different countries. So we're able to sort of continue sharing new ideas, but in a virtual way, and yeah, all the challenges that go along with that.
And a final question, what piece of advice would you give a young person or even your younger self who wants to get into a STEM related field? What advice would you give them?
So I would say follow what you enjoy the most. Maybe not necessarily what you're best at, but what you really enjoy. So I was always best at maths, but I really wanted to do something that would sort of feel like I was, you know, helping people or contributing. So so I ended up doing physics because I thought that was maybe a bit more applied, a bit more focused on the real world than maths. And then that sort of led me to medical physics because I wanted to apply physics to medical problems. So through sort of focusing on what I enjoyed most rather than what I was maybe best at, I was able to find something that I never knew existed before. I never knew about medical physics when I was at school, but it's something that I really enjoy and I'm really passionate about. So follow what you enjoy.
Follow what you enjoy. That's really good advice. Thank you, Gemma, for joining us today.
No problem. Thank you for having me.